Okay, so this is my bone video. And first I'm going to start with the scapula. Okay, so I'm going to start off with the superior border, and then this is my lateral border, my medial border, my inferior angle, my superior angle. This is the glenoid fossa. Then this is the spine, the acromion process, then the coracoid process. We have the supraspinous fossa, infraspinous fossa, subscapular fossa, and the scapular notch. So next I'm going to do the humerus. This is the head. This is the anatomical neck. This is the surgical neck, going straight across. We have the greater tubercle up here, the lesser tubercle. You have the intertubercular groove in between. Then you have the deltoid tuberosity, and then the radial groove, the trochlea capitulum, the medial epicondyle, the lateral epicondyle, the medial supracondylar ridge, the lateral supracondylar ridge. Then we have the coronoid fossa, radial fossa, and olecranon fossa. Okay, so this is the ulna, and this is the olecranon process. This is the coronoid process. Inside's the trochlear notch. And then the radial notch here on the side. Then you have the head and the styloid process. So this is the radius. We have the head up here with the neck, and then the radial tuberosity, then the styloid process, and the ulnar notch. So this is a clavicle. This is the medial or sternal end, and this is the lateral or acromial end. So this is my femur. I'm going to start with the head, then this is the neck, and then you have the greater trochanter and the lesser trochanter. Then you have the intertrochanteric crest and the intertrochanteric line. Then you have the gluteal tuberosity and the linea aspera. Then you have the lateral condyle and the lateral epicondyle, and the medial condyle and the medial epicondyle. Then you have the patellar surface and the intercondylar fossa. So now I'm going to do the fibula and the patella. Start with fibula. This is the head, then this is the neck, then this whole thing is the shaft, then you have the lateral malleus. And then this is a patella. The pointier end is the apex, and then the bottom is the base. And then to figure out if it is a left or a right, you place it on the table like it's an arrow pointing away from you. Place it on the table, and whichever way it falls is left or right. And this is obviously a left because it went to my left. So this is the tibia, and this is the medial condyle and the lateral condyle, and then the tibial tuberosity, the anterior crest, and then the medial malleus. So this is obviously a foot, and I'm going to go over the tarsals and the metatarsals, yada yada yada. Okay, so first you have the calcaneus, and the tall one right here is the talus. Then the one towards the medial side is the navicular, and more towards the lateral side you have the cuboid, and then you have the 3 cuneiforms, 1, 2, 3. Then you have your 5 metatarsals, first metatarsal, second, third, fourth, fifth, and these are the head and the bases, the metatarsals. And then you have the phalanges, which start here and go up, and you have your 5 phalanges. You have your proximal and distal end on the hallux, and then you have the proximal, middle, and distal on the rest. And it goes 1, 2, 3, 4, 5. It's counted from medial to lateral. So now I'm going to do my hand, and I'm going to start with the carpals. So first here we have the scaphoid, then the lunate, then the triquetral, then the pisiform, then we have the trapezium and the trapezoid, then the capitate and the hamate. And then you have your carpals here. So your thumb is the first, and then 2, 3, 4, 5. So your pinky is the 5th. These are your metacarpals. This is the yeah, metacarpals. So then you have your phalanges, and your thumb has a proximal and a distal, and then your other 4 phalanges have a proximal, middle, and distal. Now for this damn thing. And then now I'm gonna be like, and now we have the pelvic bone.
You should do it like that too.
I love it. Should I do it?
She's getting a lot of these. Put some humor into it.
So now we're gonna do the pelvic bone. This is the iliac crest. Then you have the anterior superior iliac spine and the anterior inferior iliac spine, then the posterior superior iliac spine and the posterior inferior iliac spine, then the greater sciatic notch, the iliac fossa, and the acetabellum, that thing. And now it's parts of the ischium that is also on the pelvic. So we have the ischial spine with the lesser sciatic notch. You have the ischial tuberosity and the ischial ramus. Yay! Now I'm going to do parts of the pubis on the pubic bone. Awesome. Okay, so we have the superior ramus and the inferior ramus. Then you have the obturator foramen and the pubic crest with the pubic symphysis thing.